In this morning's Health Watch, National Breast Cancer Awareness Month begins today, and despite the progress being made, the average American woman still has a 1 in 8 chance of developing the disease, staggering statistic. Here with a look at where we've come and how far we've come with this is Dr. Elisa Port. She's the Chief of Breast Surgery and co-director of the Dubin Breast Care Center at Mount Sinai Hospital here in New York. Great to have you with us, Doctor.
Thank you so much.
Thank you for being with us. How far have we come in this fight?
I think the areas of progress that we've made are in both early detection and in newer treatments that offer women, a significantly increased number of women, greater survival overall. So we have clearly a heck of a lot more work to do to make sure that every woman survives this deadly disease. But for many, many women, the survival is quite good.
And when we look at just the change in the times, if you go back to the 70s, survival rate 5 years was about 75%. Today, you say it's upwards of 90%.
Right. For early stage breast cancer, the survival is quite high. And I think that the key statement is early stage breast cancer. And that's really contingent on early detection. Think about what happened in the 80s, increased use of mammograms and so forth. These mammograms are the tool that allows us to find cancer at an early stage before it becomes a big lump, and this allows for better survival. So the introduction of mammography in the 80s and early detection played a huge role in decreased death rates from breast cancer.
There is so much confusion still today, though, over early detection, how to detect, whether or not a mammogram is right, and what age you begin. What do you recommend?
So the benefit of mammograms is crystal clear. Mammograms do save lives. The biggest controversy was when to start them. We have always known that mammograms starting at the age of 40 reduce the risk of dying from breast cancer. The controversy over the fact was over the fact that in the 40 to 50 year age group, you have to do more mammograms and do more biopsies to actually detect a breast cancer. And so what the United States Prevention Service Task Force was saying about a year or two ago, and why the controversy arose, is they said, you know, maybe it's not worth it to do all of these biopsies. But we know that mammograms save lives in that age group, the same as with the older age groups. And those of us who do this for a living and who are in the trenches trying to cure breast cancer continue to advocate for mammograms in that age group.
Where do you see the future of breast cancer awareness and research and new science development in the next 10 to 20 years going?
Right. I think one of the things that is really exciting is the fact that not only are we working on developing newer imaging techniques to pick up breast cancer earlier and earlier, but we're working on improving the techniques that we have. So, for example, mammography, which we know works, there's plenty of room for improvement. We have, for example, the Dubin Breast Center, one of the only in New York 3D mammogram machines. And this will hopefully improve on the technology that we have. We don't know if it will pick up cancers earlier, but the optimism and the hope is that we'll be able to do so.
Dr. Elisa Port, thank you for what you do. Thank you for being with us. Thanks for fighting the good fight. We appreciate it. For more on the latest in the fight against breast cancer, go to our partner in health, WebMD.com, and search breast cancer.